just flavored water, right? There are harmful chemicals within the vaping fluid which will damage your lungs. Okay, so when I talk about children, some of you may remember the slide from last time, but if you look at lung development, it's a very busy slide, but nevertheless, if you look at lung development, one would think that by the time one is born, your lungs are fully developed. That is not the case. In fact, early childhood is very important in terms of lung development. This is the reason why chronic lung diseases in childhood can affect your peak lung capacity. Also, damage to the lung or developmental delays in the lung can predispose you to COPD. But if you look at this chart and you look at this x-axis at the bottom, we only truly reach full mature lung after the age of 21, around 25. So all the inhalations that you're doing before then, maybe it's pollution, maybe it's secondhand smoke, maybe it's vaping, is going to damage your lung. Okay, and then to look at other causes of COPD, and you'll understand why now I said that perhaps South Africa has underreported their numbers in COPD. Tuberculosis and HIV predispose individuals to developing COPD. Long-term asthma, which you correctly mentioned. Also, inhalation of biomass fuel smoke. So individuals in a rural community burning wood, burning dung, and inhaling that smoke predisposes to COPD, non-smoking related, as well as genetic abnormalities and pollution. So what exactly is happening in the lung when COPD occurs? As you can see from this diagram, I did mention before there are two components: chronic bronchitis, which is at the top, and emphysema. And in chronic bronchitis, you can see this is a nice, normal, healthy airway. And next to that picture, you can see that this airway looks much narrower. You can see that there's mucus here. You can see also that this wall is thick because it's inflamed. Okay, and all the mucus and inflammation reduces the airway capacity. If we look down at the bottom, which is the alveoli, these are normal alveoli which will change oxygen and carbon dioxide normally, but with ongoing exposure to smoke and toxins, these interfaces break down and then they don't function well to change oxygen well. So what symptoms do these bring about? What symptoms are patients complaining about? They will be breathless, they will have phlegm, they may have a cough that persists. And importantly, these are not symptoms that are there just for a few weeks. They are ongoing, they continue, okay? And symptoms will progress if they're not treated. Now, how do we know if we have COPD? How do we make a diagnosis? Very importantly, COPD doesn't affect everyone who smokes, okay? In order to make a diagnosis of COPD, which means that the lung is significantly compromised for you to require medication, you will need to have a lung function test. There are various number of you who've had lung function tests with me and maybe with others as well. And you will know that this is a blowing test that looks at the lung capacity. When we do the test, we are looking for narrowing, reduced flow in the airways to confirm the diagnosis. We may give you a puffer, an inhaler in between and repeat the test to show whether your airways are opening up. Usually with COPD, the airways don't fully open up, but if they do open up, you may have asthma and not COPD. So also in the context of exposures to smoking or other toxins or inhalants, we will make a diagnosis of COPD. Very important. COPD doesn't have a cure. And as much as there isn't a cure, we're really very lucky because there's really very good treatment available for COPD. So it's a condition that can be well managed, okay? And how do we manage this condition? First, we have to reduce the harm, stop the exposure. So the most common cause, we must stop smoking. And for those of you who've been to my office, I'll always ask you, if I know that you have been smoking, are you still not smoking? Have you stopped smoking? Have you reduced the number of cigarettes you're taking? And I may even offer to help you with some medication to reduce the need to smoke. And you will know, many of you are on some of these inhalers, you will know that there are inhalers that will help open up the lung, relax the airway so that they can open so you can breathe well. So there are various inhalers that you can use, and this allows the medication to get directly to the lung and not into your bloodstream and cause problems in other parts of the body. There are also some tablets that you may take, although those are secondary forms of treatment for COPD. Vaccination. So we look at preventative strategies as well, not for preventing COPD, because once we make the diagnosis, we have to ensure that we keep your lung function as well as we can for as long as possible. And many of you will know that when you have chronic lung disease like COPD, your risk for developing infections is much higher. This is because with the damaged lung, the immunity in the lung is compromised. So we will advise you to do vaccinations, and I think Hanali will be telling us a little bit more about vaccinations and things that we can use to prevent COPD. So this is a preventative strategy. And very importantly, and I'll come to this shortly, COPD is a condition where you have to optimally maintain your lifestyle. So by that I mean good, fresh food, sunlight, and exercise. Importantly, if you developed an infection or you develop a COPD attack or exacerbation, treat it quickly, treat it timelessly so that it doesn't progress and it doesn't get worse. And importantly, to see your doctor regularly to check on your lung functions. Okay, what can happen if your COPD progresses either without treatment or if you've been on treatment for a long time? What may happen? So you may have difficulty with breathing where your oxygen is not enough to sustain you. You may require long-term oxygen. This is called respiratory failure. There may be a strain on the heart which creates cardiac compromise, and the lung may even collapse. So the things we use, I've mentioned these before, vaccinations, medical treatment, oxygen therapy, lifestyle changes. I didn't mention surgery. Surgery is reserved for a small proportion of patients who will benefit from removal of damaged lung. Many times patients are not well enough to tolerate surgery as well. In Europe and the US, transplantation comes a little bit higher up on the list than locally, but even then it's a very late form of treatment, and the primary form of treatment is inhaler therapy. So what about exacerbations? Some of you have had exacerbations where your COPD gets worse at a period of time, and then we have to manage it and get it better. And if we look at that, exacerbations, we've got to treat acutely, maybe antibiotics and so forth, as well as supplementary oxygen and steroids. Now, COPD is not a disease of the lung alone, okay? COPD is a multi-system disease, and this is why we have so many people involved here. Patients with COPD are at risk for lung cancer. Patients of COPD don't usually die from their COPD. They die from cardiovascular disease. They have an increased predisposition for developing diabetes as well as hypertension. There's an increased propensity for anxiety and depression, as well as obstructive sleep apnea. And with time, because they're using so